Hello friends, I am Dr. Ashish Sarwal, urologist and men's health expert from New Delhi, India. In this video, I will show you an interview of a 58-year-old gentleman who has come from another part of Delhi, and he is here after 3 months after his Tectra implant surgery. So after he went, he recovered, he was traveling a lot, and he mentioned and sent me a message that he has traveled to many airports, the implant could not be detected. So it was a very good thing, and he was quite happy that he can move around without any problem through the airports because he was traveling in his job a lot. Apart from that, in these 3 months, he is wearing formal clothes, he's able to conceal the implant, and he's able to have good intercourse with his partner. So he's quite happy. He just came today for a regular checkup. He was not having any problem. So I requested him to give us a short review of how he's feeling after 3 months. So yes, please.
Thank you, sir. Thank you very much for your kind gesture. I had this problem for last about a year, and I'm also a diabetic patient. Diabetic treatment I'm taking for last 2.5 years, and I remember that I contacted you maybe around third quarter of 2024, and it was pleasure that you immediately responded. And I have seen one thing which is very, very different from many people, is that you are very quick in responding to your messages, especially to your patients. Really, I thank you for that. When it comes to myself, I had these problems. I did approach Dr. Sir, and Dr. Sir was quite kind enough to give me a detailed review that what should be done for me, and I opted for this implant surgery. I think I tried some medicines and all, but the medicines were not so effective. And then I thought that all these medicines which are going inside the body are going to give some or the other negative effect to my health. So it's better to have a foreign body inside. Maybe this is it. It has taken a bit of time for me to get these things accommodated within my body, and within my body has taken some time to take it inside, like accept it inside the body. Yeah. But I thought that it is better to be in this world rather than just eating tablets and medicines and going with that. As regard to the concealability is concerned, I see that this Tectra implant, which Dr. Sir has advised me, is one of the best implant, because for concealability perspective, it is perfect. I can wear my formal clothes, I wear my jeans, anything is there. That's not a problem, absolutely. When it comes to getting detected somewhere, like I had a small concern that if suppose I go to a overseas country, especially maybe UK, I'm not going to US, but at least UK, and Heathrow is very, very stringent towards the security and all those things, Heathrow, Frankfurt. So very first time when I was going, I was really thinking twice that how should I bypass and how should I try to explain them that I have this foreign body in my within myself. But fortunately, I was very surprised when I crossed the Frankfurt airport. Nothing, no deduction. I just crossed out. And then I was in Helsinki. In Helsinki also was the same thing, Stockholm. So when I came back, I dropped a message to Dr. Sir that maybe he can give advice to his future patients that this implant is a very effective implant, and it doesn't get traceable also. Like it is something like a global approved material. Whatever has been used in Tectra implant, it gives a big confidence. And then I had another trip which I was there in. I went through Frankfurt, then Heathrow, and then back the same route. Again, I was having the same thoughts, but then nothing happened. So then I feel that yes, this is a right thing. Now I'm confident. I don't need to carry all my papers with me, because in both my trips I was carrying all my medical papers, so that if somebody asks me, I show him and all. Yeah. So these two things are important, which I see, and especially for this Tectra implant which I am using. I don't know about the others, what the other implants are, but this is I'm quite satisfied with this implant.
Good. And how is the quality of intercourse? Like, are you able to have good penetration with it?
Absolutely, that's not a problem. Okay. It is just like what used to be before. So there is no as such. I don't see any difference in that part.
So does your partner know that you are having an implant?
Yes, my partner knows that I have an implant, but to be honest, it's absolutely no issue.
Like natural?
Natural, yes.
Okay.
It's natural.
So by and large, you're happy that you underwent the implant surgery.
I think it is a good idea to go for implant rather than just keep on taking pills and
Yeah.
damage your kidney or some other part.
Yeah. So see, like what he said about the concealability. He was able to go into the airports and airport security. There was no beeping of the security system with the Tactra implant in. I always tell the patients that the Tactra has an inner core of nitinol, that is nickel and titanium alloy. So nickel titanium alloy is basically something which is not detected on airport scanners. Like airport scanners basically detect metal. So if it's a pure metal like silver or steel, which is there in other implants, so that is not there in the Tactra implant. It is a nitinol core. It is a nickel and titanium alloy. So that is one thing which helps in the concealability, and the same thing also helps in the rigidity of the implant. It is very hard, and along with that there is the silicone coating around the nitinol core which gives a natural feel to the patient and to the partner during intercourse. So it has got many advantages, and especially in diabetic patients who have severe problem, the blood vessels are getting blocked and blood is not flowing properly. This is a very good option, especially if the medicines are not helping. So I thank sir, who is 58 years old. I won't want to tell the name. And I always tell all the patients who come for a review a big thank you, because if I do 100 implants, only one of them agrees for an interview, because obviously it is a very confidential matter and everybody is scared and don't want to reveal anything. So he gave a very nice review. This also gives awareness to the patients that who are scared that they want to go to the airport, will it get detected on the airport, because they don't want to tell it to anybody. Even if they can produce a card which we give, but always it is preferable if nobody asks them anything. So I thank him for the good review he has given. If you are also having erectile dysfunction or diabetes and you want to consult me, or you think of implant for which you want to contact me, you can contact me on email or WhatsApp. My email address and WhatsApp number are given in the description. Thank you.
Thank you.
Okay.